Hi, my name is April Diaz with the Training and Development Department at Chapters Health, and I am going to be demonstrating subcutaneous device insertion. So as always, we want to make sure that we review the order from the provider, and I am introducing myself to the patient, and I am using two patient identifiers, and I will perform hand hygiene in front of my patient and also explain the procedure to them. So after performing hand hygiene, I want to don some clean gloves, and I want to really figure out which area of the body that I want to use. So depending on if it's medications that we need to use intermittently, or if I have a continuous infusion of medications, or if I am performing hypodermoclysis, which is subcutaneous hydration. So for intermittent medication, I think that the back of the arm will work just fine. So that's the area that I'm going to use. So now I want to remove these gloves and gather my equipment. I have, or my supplies, I have an IV start kit, I have a saline flush, and my actual sub-Q needle here. So hand hygiene again in front of the patient. Okay. Don clean gloves. Okay, and I'm going to open up my supplies here. So to prep my device here, this is what it looks like. Okay, so to prep this, there's a little plastic cap here that I want to remove. And I want to take my needleless connector using a no-touch sterile technique, remove that cap, and it's going to go right on here, right there. Okay, and I'm not touching in this area. Again, I'm using that sterile no-touch technique because now I want to take my saline flush and prime this device right there. Okay, I'm going to prime it. There we go. It just takes a tiny little bit of saline to prime that. Okay, set it to the side for now. I want to take my ChlorPrep sponge, and now over here on the area that I've selected, go ahead and clean it vigorously for about 30 seconds. When 30 seconds are up, we're going to let that dry completely. Okay, and once it's completely dry, I want to take my device here and grab the wings. There's like little grippy pieces on the device. That's what's going to be touching your fingers here. There we go. Remove your cap. And you want to pinch the skin. And with this, you do want to go in at an angle. The idea here is that you want the needle tip to be in the subcutaneous tissue. So the angle that your needle is really depends on how much subcutaneous tissue the patient has in this area. So I'm pinching the skin, I'm going at an angle. Okay, and then now I want to stabilize this here, because what I want to do is go ahead and aspirate. I'm looking for blood return. If I do get blood return, that means that I'm in a vessel, and I don't want to be in a vessel. I want to be in the sub-Q tissue. So if I do get blood return, then I would, of course, remove this, hold pressure, and then go ahead and start over at another area with new supplies. Okay, no blood return, so I'm going to remove the flush, and I want to stabilize this again and really stabilize it well, because this is what I want to do next. I want to take this piece here, and you'll see there's little grips on here as well. That's where you want to touch it. That's where we're going to remove the needle. So go ahead and pull. It takes a little bit of pressure here. Keep pulling until that piece comes out. There is your needle protected, and we're going to put that into the sharps container. All right. So what's left in here is just that plastic catheter. So now we want to take our window dressing and cover the area. Just like that. You can use extra tape if you need to. And make sure you label this with the date and your initials. Okay. So that is the subQ device insertion. And to remove it, it's very easy to do. Make sure that you are explaining the procedure to the patient. You have identified them already with 2 patient identifiers. You've introduced yourself. You've explained to them what you're doing. And don't forget to perform hand hygiene. Put on a new set of gloves. And make sure you have your gauze and maybe a Band-Aid or some tape ready. You just want to peel this away. Okay. Hold some pressure there. And you can see there's a little plastic catheter in there. So this is a really nice device that we're using here. Okay, hold pressure. This can go in the actual trash. You don't need to put this in the sharps container because there are no sharps on this. Hold pressure until bleeding stops, and you can put a Band-Aid over there, or you can just put your tape there. And I want to throw away my gloves and also discard all of my other supplies in the trash can. That is subcutaneous device insertion.